Alright, the last thing that we're going to talk about here is our autoimmunity and some of the immunodeficiencies. Sometimes in your type 2 and type 3 hypersensitivities, the immune system loses a tolerance to your autoantigens, to your self-antigens, and it will form these antibodies and sensitize your T cells to fight them. And it can cause disruption systemically or specifically in organs. We're talking here about systemic lupus, erythematosus, rheumatoid arthritis, myasthenia gravis, multiple sclerosis, and of course your genetics as well as your gender and environmental factors will influence this as well. These are the autoimmune diseases. You're familiar with a lot of them, and it tells you what type of hypersensitivity it is. You see there the systemic lupus, erythematosus, the rheumatoid arthritis, Hashimoto's disease that targets your thyroid, pernicious anemia that targets your stomach lining, myasthenia gravis that will target your muscles, type 1 diabetes, multiple sclerosis destroys your nerve cells. Those are all examples of the autoimmune diseases. Now, speaking about them specifically, the systemic lupus erythematosus, or just lupus, where the patients produce autoantibodies against tissues and organs. You can have facial rashes, skin lesions. It can affect your kidneys, your bone marrow, your nervous system, your joints, your heart. Rheumatoid arthritis. It's going to attack your joints and cause chronic inflammation. It can also involve your lungs and your eyes and your skin and your nervous system. You can see the lupus in figure A. You see the rash, and then of course rheumatoid arthritis over there in figure B. Those are systemic. Now your endocrine glands can also have this happen. Graves' disease, that affects your thyroid and causes increased levels of thyroxine, the hormone that's produced by the thyroid, and you have hyperthyroidism. Hashimoto's causes underactivity of the thyroid, and so you're going to make less amounts of that hormone, and it's hypothyroidism. You see type 1 diabetes, it goes after the cells in your pancreas and affects your production of insulin. Myasthenia gravis, this is going to attack your muscles and cause muscle weakness or even complete loss of muscle function and death. Multiple sclerosis, that attacks your nervous cells, your neurons, and it can be paralyzing, cause weakness and tremors. It's also responsible for some loss of speech and vision as well. Now, immunodeficiency is where your immune system is not working like it should. It may even be your immune response may be totally absent. And these deficiencies are deficiencies with your B cells, your T cells, your phagocytes, and your complement. The diseases can be primary, which is what you're born with. They're congenital, and it's usually because of a genetic error. Or it can be secondary, where you acquire it after birth. The secondary immunodeficiencies, we've got these categories of diseases. These are the ones that are acquired after birth. It can be from natural causes, like you've had an infection like AIDS or leprosy or tuberculosis or some types of cancer. It can be caused by nutritional deficiencies, stress, pregnancy, or aging. Sometimes people are exposed to immunosuppressive agents that suppress their immune system, like steroids, or there's been some irradiation the drugs that they have to take to keep from resisting a graft or a transplant. Maybe your spleen has been removed or you have cancer. And with cancer, the abnormal cells are going to continue to grow. If it's a tumor that's benign, it's not going to have the cancer cells. It's self-contained. It's not going to spread. But if it's malignant, we call it cancer, and it can spread. And causes can be anything from errors in mitosis to genetic damage to activation of the oncogenes or the retroviruses. Now, your immune system is constantly surveilling and checking to find cancer cells and eliminate them. And this is primarily done by your cytotoxic T cells and your natural killer cells and the macrophages. So what autoimmune disease results in damage to acetylcholine receptors and blocks nerve signal muscle fibers? It's attacking the muscles. Myasthenia gravis.